I'm going to zoom in now on the left hand side, and you're going to recognize a lot of the same buttons from earlier. All right here. I won't go into that again. If you want to add a new type of exam, add new, and off to the side it'll pop up options. You can add a comprehensive, an intermediate, a contact lens progress check, an RX check, cataract post-op, or communication. We're going to add, let's hit the X for a second. If you want to edit your record, this is where you can edit. Once you've signed off on a record, you can still go in and edit it, but the staff will not be able to, and no other doctor can go in and edit your record. That's why it's important that you sign off on your records, because once you've signed off, nobody else can get into the record. But as long as you have not signed off, then anybody can edit your record. So I always encourage you to finish your exam, sign off on it so that it can no longer be edited except by you. The next one is next and back and today, and that's where you can jump back and forth between previous records on the patient. Today would be just jumping to today's record. Find, if you want to find something specific, you click on that and it'll pop up different type of exams if you're looking for something in particular. The search option you don't need to worry about. Print. There are two types of records you can print in the office. One is a complete exam, and that says print everything in the record on that day. It only prints that day's record, but it prints everything. It's usually about 4 or 5 sheets of paper. You'll be surprised what a complete record shows. A positive is what you're going to use 99% of the time. It basically says print only those things that I typed or that I clicked that were important. A lot of times you're going to just do what's called default tab fill and just fill in normal for a lot of things. You really don't need to print that. So a positive is a summary of what's wrong with the patient. 99% of the time, just print this. Really the only time you ever need to print a complete record is for an attorney. Even when patients say they want copies of their records, I just print the positive. It prints out 1, maybe 2 pages. It is pretty much the most important part of the exam. And so again, to save on paper and time, please try not to print out complete records. Print out the positive. The rest of these you don't need to worry about. Preview is if you want to preview a record before you print it. Layout you don't need to worry about. Tab. Tab is if you want to add an additional tab down here. I'll go into what these tabs do. It's going to be hard on you to add a tab on the fly. You're not going to know what each tab looks like. I'll go ahead. Delete. I would highly recommend that you do not delete any record. You will have the power to do that, but once you delete, it's all gone. You cannot delete someone else's record that's been signed off, but you can delete your own record, and again, once it's gone, it's gone. It's very rare that we delete anything. HCM you can ignore. Sign off. So when you're ready to sign off on the record, this is what you click. I don't like the fact that it's very small right there, but this is the only place to sign off on a record. Charges is where you can enter charges for the patient, and I go into that on another video, but this is where you can put in the charges. Review, receive, don't worry about. View is if you want to look at some report. Really, you're not going to need to use it. Images, if you want to look at one of the images that you've worked on, you rarely need to use that. Sticky is if you want to make a little note and have it popped up. I don't really use sticky notes. I use alert messages. Meds, communication, ERX, and portal This just tells you where the information is at. You really won't use them very often in this capacity right here. There's other places for them that you'll find them more beneficial. And again, what's important over here is the name of the patient, the age, what type of exam you're doing. I also look up here for their name and their account number and make sure that's correct. Every now and then you'll have two Mark Westons, and I want to make sure that I've got the right account number pulled up.